So, targeted receptor therapy is the concept of using several different medications to go after different receptors that all contribute to the patient's chronic pain. A lot of folks that have chronic pain are locked in a cycle called central sensitization. So, this is a $5 word that basically means there's a nasty feedback loop that's set up in a patient where pain begets more pain. Painful impulses initially start hitting the backside of the spinal cord. They cause a situation called wind up. More inflammatory chemicals are created, and then that causes more pain to go back to the spinal cord. And before you know it, it's pain causes more pain, causes more pain. And unfortunately, a lot of these patients have turned to opiate medications, Vicodin, oxycodone, this sort of thing. And there's another component of chronic pain that's called opiate-induced hyperalgesia. That's another one of those $5 words that basically means that over time, the opiates can start sensitizing the pain receptors, and then they start causing pain in and of themselves. When a patient gets locked in this cycle, then they're really in a pretty dark space. So what we try to do with targeted receptor therapy is go after all the receptors, everything we can find that all contributes to causing this pain. Now, one of the big ones is the NMDA receptor. That's the main one. That's the one that ketamine blocks, and that's how it can derail chronic pain. But there's also involvement of sodium channels, there's calcium channels, a variety of other things that all work. So that's why we try to incorporate in appropriate patients IV lidocaine, IV magnesium. We'll sometimes put in dexamethasone, which is a steroid, ketorolac, which is an anti-inflammatory. So we try to create a custom designed program that goes after these different receptors and tries to just attack them from several different angles so we can maximize the likelihood that we're going to try to break a patient's cycle of chronic pain.